In the healthcare scandal that's rocking the Department of Veterans Affairs and raising questions about how much VA Secretary Eric Shinseki knew. 2 veterans groups and 3 Republican senators have called for him to resign. Our Drew Griffin has been leading the reporting on the story for the past 6 months, breaking new information that sparked congressional investigations. CNN's investigation found as many as 40 veterans died at a Phoenix VA hospital. That's according to a doctor who used to work there. And according to sources, many of those veterans were on a secret waiting list to hide long delays for medical care. No one at the top has been held accountable for all of this, we should add. That might be about to change. Drew Griffin joins me now. So, Drew, you're in Texas working the story, but there was a lot of action in Washington today. What happened?
2 big movements. The first one, the House Veterans Affairs Committee voted unanimously, basically, that they've had enough waiting for information on that secret list out in Phoenix, Anderson. They have subpoenaed all emails and communications between Veterans Secretary Eric Shinseki and his staff concerning that secret list in Phoenix. He has until May 19th to produce those documents to the House. Secondly, just about at the moment that vote was taking place, Eric Shinseki ordered a national review of all VA facilities nationwide to determine in face-to-face audits just how long these vets are waiting and to see what the problems are. So 2 big developments there in Washington. Anderson?
As we mentioned, you're in Texas, and I understand you talked to someone who has some other troubling details about another hospital.
Yeah, and we can report tonight there is a brand new investigation at yet another VA hospital, and this again involves cooking the books, allegations of cooking the books, and making vets wait for care.
San Antonio, Texas is the latest location where investigators from the VA's Office of the Inspector General are on the ground, trying to determine if managers at this sprawling VA hospital were trying to hide the fact veterans had been waiting months to get care, and if any veterans died as a result. The allegations come from this clerk, who works in the hospital's medical administrative services and is speaking publicly for the first time. Brian Turner says his job is to help veterans secure appointments. He says he was told to fudge the numbers. He was to meet the VA's own national timeline goal for setting appointments. That goal, no more than 14 days from when a veteran wants an appointment called the desired date. The problem, he says, the appointment deadlines cannot be met. So he says he was instructed to simply schedule the appointment months and months in advance, while making a note that this is the veteran's desired date.
What they're saying and what we've been instructed was that they're not saying fudge, there's no secret wait list, but what they've done is come out and just say zero out that date. There's been a report the following day if someone has a wait period that's longer than the 14 days. The standard is the 1 to 14 days within the timeline of a desired date.
Irregardless of when the appointment
Doesn't matter when.
took place.
Correct.
So it could be 3 months and it looks like 14 days?
It could be 3 months and it looked like no days. It looked like they had scheduled the appointment and got exactly
fudging the
what
books
they
is
want.
that's my
I would call it that. You can call it that. The VA doesn't